Welcome to our guide on sleep apnea and its impact on health. Sleep apnea is a condition where your breathing is repeatedly interrupted during sleep. It can affect various aspects of your health, including weight, mood, and overall sleep quality. In this video, we'll explore how sleep apnea can lead to weight gain, disrupt your sleep, and potentially cause depression and nightmares. We'll also cover treatments like positive airway pressure therapy, including CPAP and BiPAP machines, which can help manage sleep apnea and improve your quality of life. Whether you're new to this topic or looking to understand more about managing sleep apnea, this guide will provide you with valuable information and practical tips. Sleep apnea is a condition where your breathing stops while you're asleep. Your brain continuously monitors your body and adjusts things like heart rate and blood pressure. When you stop breathing, your blood oxygen levels drop, which can happen because of either apnea or hypopnea. Apnea. This occurs when you stop breathing almost completely while you sleep. The Greek word apnea combines a, meaning not, and PNEA, meaning breathing, so it means breathless. Hypopnea. This happens when you breathe too shallowly to keep your blood oxygen levels up. Hypopnea combines hypo, meaning low, and pnea, meaning breathing, so it means low breathing. When your oxygen levels drop, your brain triggers a reflex that wakes you up just enough to start breathing again. Although this reflex keeps you alive, it disrupts your sleep cycle. This means you don't get the deep, restful sleep you need. The more severe your sleep apnea, the more often these interruptions occur. Doctors measure the severity using the Apnea-Hypopnea Index, AHI, which counts how many times you stop breathing per hour. Mild sleep apnea, an AHI of 5 to 15, meaning 5 to 15 breathing interruptions per hour. It may not always need treatment if symptoms are mild. Moderate sleep apnea, an AHI of 15 to 29, meaning 120 to 239 interruptions during an 8-hour sleep. Severe sleep apnea, an AHI of 30 or more, meaning 240 or more interruptions in 8 hours. Apnea events can happen during any stage of sleep but are most common in the lighter stages and REM sleep. Central sleep apnea is most common in the lighter stages of sleep but can occur at any time. Symptoms of sleep apnea: feeling very tired upon waking, even after a full night's sleep. Daytime drowsiness that affects daily activities. Snoring, though not everyone with sleep apnea snores. Mood changes like depression or anxiety. Problems with memory or concentration. Waking up multiple times during the night, sometimes without remembering why. Noticed pauses in breathing by others. Unusual breathing patterns such as fast breathing that then stops and starts again. Insomnia. Night sweats and restlessness. Sexual dysfunction. Waking up feeling short of breath or choking. Morning headaches. Children can also have sleep apnea, and their symptoms may include hyperactivity or trouble focusing, sometimes mistaken for ADHD, loud snoring, bedwetting, frequent arm or leg movements while asleep, sleeping in unusual positions or with their neck extended, reflux or night sweats. Sleep apnea can be caused by several factors and may run in families. The three main types are obstructive sleep apnea, OSA, the most common type, where the muscles in your throat relax too much, blocking the airway. Central sleep apnea, CSA. This happens when the brain doesn't send the right signals to the muscles that control breathing. Causes can include heart failure, low oxygen due to high altitude, nervous system damage, or treatment with CPAP for OSA. Mixed complex sleep apnea. This type involves a combination of obstructive and central sleep apnea events. To diagnose sleep apnea, your healthcare provider will ask about your symptoms and medical history. If sleep apnea is suspected, they will likely recommend tests to confirm it. What tests are used to diagnose sleep apnea? Here are the most common tests for diagnosing sleep apnea. Overnight sleep study polysomnogram. This test is done overnight in a sleep lab, where you sleep while various sensors monitor your heart rate, breathing, blood oxygen levels, and brain activity. This is considered the most accurate test for diagnosing sleep apnea. Home sleep apnea testing. This test allows you to complete a sleep study at home with simpler equipment. It doesn't measure brain waves and can't diagnose central sleep apnea. It's often used when severe sleep apnea or other conditions are not suspected. If a home test is inconclusive, an overnight sleep study may be needed. Next, we will tell you about how is sleep apnea treated. Treatment for sleep apnea varies based on its type and severity. While there's no cure, treatments can help manage symptoms and reduce the frequency or severity of apnea events. Here are some treatment options. Some conservative treatments such as Weight loss, losing as little as 10% of body weight, can improve or even resolve sleep apnea. Position changes, using special pillows to avoid sleeping on your back can prevent soft tissue from blocking your airway. Nasal sprays and adhesive strips. These can help with mild sleep apnea or snoring, but are not effective for moderate or severe cases. Treating underlying conditions. Managing conditions like heart failure can improve central sleep apnea. Medication changes. Reducing or stopping opioid medications may help with central sleep apnea. Positive airway pressure, PAP devices. CPAP. Continuous positive airway pressure. Continuous positive airway pressure, CPAP, is a therapy that uses a steady flow of air to keep your airways open while you breathe. The air pressure is continuous, meaning it stays at a set level throughout your breathing cycle. CPAP provides a constant pressure of air measured in centimeters of water pressure, cmH2O. This pressure helps keep the airways open, preventing them from collapsing. Unlike BiPAP, which has different pressures for inhaling and exhaling, inspiratory positive airway pressure or IPAP and expiratory positive airway pressure or EPAP, CPAP maintains the same pressure all the time. Benefits of CPAP. Prevents collapsed lungs. By keeping the airways open, CPAP helps prevent the collapse of lung tissues. Improves lung function. It increases the surface area of the alveoli, air sacs in the lungs. Improves the matching of air and blood flow, VQ matching, and enhances oxygen levels. Aids ventilation. While CPAP can help with ventilation, it may not be enough on its own. For more support, additional pressure is often needed during inhalation, which is provided by BiPAP machines. BiPAP machine. A BPAP machine is a type of non-invasive ventilation, NIV, therapy designed to help people breathe more easily. BiPAP machines are used both in hospitals and at home. Home models are small and compact, roughly the size of a toaster. They have a tube that connects to a mask which you wear over your nose and mouth. Like other ventilators, a BiPAP machine uses air pressure to help you breathe. The machine improves oxygen levels in your blood and lowers carbon dioxide levels by pushing air into your lungs. Next we have lifestyle considerations such as avoid heavy drinking and sedatives. These can worsen sleep apnea. Follow medical advice. Your healthcare provider can guide you on which medications and lifestyle changes to make. Next, for managing symptoms and recovery. Avoid self-diagnosis and self-treatment. Seek professional help if you suspect sleep apnea. Provide evidence. Video or audio recordings of sleep can assist healthcare providers in diagnosing sleep apnea. Recovery time. Some people feel better immediately after starting treatment, while others may need several months to see full benefits. Newer devices often adjust automatically, while older ones may need adjustments. Overall, most people notice improvements quickly when using PAP devices, although it might take time to get used to wearing a mask. Sleep apnea can make you gain weight in a few ways. Increased hunger. Poor sleep can make you feel hungrier and lead you to eat more, especially foods high in calories and carbs. This extra eating can cause weight gain. Reduced energy. When you don't get enough sleep, you're likely to feel more tired and have less energy for physical activity. With less exercise, you might not burn off as many calories, which can contribute to weight gain. Impact on teens. Lack of sleep can particularly affect teenagers who need quality sleep for proper brain development. If teens don't get enough sleep, it can disrupt the part of the brain that controls hunger and energy use. Hormone imbalance. Sleep apnea can affect hormones related to hunger. Leptin, which helps you feel full, may be high in people with sleep apnea, but this can lead to leptin resistance, meaning you don't feel satisfied after eating. At the same time, ghrelin, a hormone that makes you feel hungry, might be elevated. This combination can lead to overeating and weight gain. Overall, not getting enough sleep can lead to changes in appetite and energy levels, which can contribute to weight gain over time. In conclusion, sleep apnea is a serious condition that disrupts your breathing during sleep, leading to poor quality rest and various health issues. It can contribute to weight gain by increasing hunger and reducing energy for exercise. Diagnosis often involves tests like overnight sleep studies, and treatments range from CPAP and BiPAP machines to lifestyle changes and surgery. Managing sleep apnea effectively is crucial for improving sleep quality and overall health. Please click on the next video for more Live Good info. Thank you very much.